I have two questions. One is, what are states' options for addressing Obamacare? We've heard of don't take it, but right now we seem to be we all seem to be a lot about don't do this, looking for innovative, common sense, conservative solutions, continue to be, that have been addressed actually before Obamacare came about. And then secondly, kind of a follow-up is, set Obamacare aside a moment, what are some state initiatives that can be done? I'm reading states fighting back on healthcare. What are some real valid, doable state initiatives to address our healthcare challenges? Because if we don't offer a solution, then we're all about knowing that hadn't done us so well in the past from time to time.
I can give you one example that I think it speaks to some of these concerns about primary care, as well as being a positive solution in terms of reducing costs and improving access, and that's scope of practice. We've touched on this a little bit at the Heritage Foundation, but it's certainly something that I've previously worked on. And there actually was another article in the Wall Street Journal today about this, about how some states are trying to reform their scope of practice laws. I know it's very difficult because you have entrenched special interests in the state capitals. My personal view is that a guild is a union by another measure. And so, but you have those people trying to go in there, and I think, healthcare professionals should be able to practice at the top of their license. And so to the extent that we can get some reforms on the state level that deregulate some of that and allow people to practice, I think that will help reduce costs, and I think it will improve access to care, and it's something that we can do in a very kind of pro-market solution.
And I would add to that one more very, very granular example. Every one of your state legislator in here, I hope you all have physician advisory councils of only physicians that you meet with monthly or quarterly, whatever it is, and talk to doctors so they actually know what they're thinking. I would hope that's a bare minimum of what you're doing, because they're the people that matter the most. And by the way, their approval ratings are about 4 times yours. So the more times you can get pictures of people in white quotes, in white coats, the better. But if you can get physicians and nurses and others together, keep in mind, access to health insurance is not access to health care. In Canada or on American Indian reservations, it's all free. That doesn't mean we can see a doctor who's any good. Certainly doesn't mean you see the doctor that you want. It may not guarantee any sort of quality whatsoever. What you actually want to be able to do is see a doctor when you need to see a doctor, or see a nurse when you need to see a nurse. If you had advisory councils in your district, you could help doctors, and there's a lot of doctors, it's not just concierge medicine, it's full ongoing gulp that are taking only cash. And that's a growing trend. And it's amazing how inexpensive routine care is when you don't have insurers in it, you don't have bureaucrats in it, you don't have lobbyists in it, you don't have all these people in it that are grabbing from the system. You can easily have a network in your state legislature of here are 4 physicians that take cash. Here, it's not that expensive. Now, does that solve everyone's problems? Of course not. But it's providing options, it's providing direct access to care, which is people want. Access to health insurance is not the same thing as access to healthcare services.
And well, as far as the states are concerned, it's going to be depending upon your governor and whoever your Medicaid director is. Because in Arkansas, while the Republicans took the legislature for the first time in 138 years, we still had a Democrat governor, and of course he appointed the Medicaid director. And so we were very, very limited as to what we could actually do. I mean, if you had a conservative governor, conservative, Medicaid director who was willing and open to, I would say the first thing is try to go after, the block grant and global waiver. I don't know if the Obama administration would approve it or not, but hey, let's give it a try and let's see what happens. So that would be the first thing that I would say to do: get control back to your states, and then craft a policy. Like I said, either with the catastrophic health plans, if you have to pass legislation in order to allow that to happen, you may need to do that. Try to get some of the employment focus off of there and see what you can do to engage the faith-based organizations in your state. So those are just two.
I have one additional thing, which is sort of a sideline to this. There are remaining legal cases against Obamacare on a number of facets. We'll see whether the one from Oklahoma that's challenging the subsidies, advances. But one of the interesting areas that I think is sort of a sideline issue for you, religious liberty is still an 80-20 issue in the states, in the sense that when you look out at the requirements for religious employers to provide coverage for things that are against their religion, that is an 80-20 polling issue where even people who disagree with them don't believe that they should be forced to require it. And that's the sort of thing where I think, depending on the laws within your state, depending on if you have a mini RFRA or if you have something along those lines, Senator Marshall at Heritage is working on model legislation on that front. It would be good, I think, for legislators to put something forward that would help exempt some of these employers with religious opinions, basically saying, yes, you can continue to practice your business without having to compromise your beliefs.
And this is a follow-up just to Chris on the scope of practice, because that's a huge issue. And are we talking about expanding, allowing APRNs to do more types of services, to optometrists to do ophthalmology? Or are we talking about other things? Because that's a huge issue there, and there's a lot of dangling impacts of that.
Yeah,
One clarification.
I mean, I think broadly speaking, to the extent that medical professionals should be able to practice at the highest scope of their license, and that, you know, there are all sorts of battles being fought on all sorts of different state levels surrounding it. But I think broadly, that would expand access to healthcare, potentially reduce costs if you can get people going to a minute clinic, you know, with a nurse practitioner versus a doctor's office for routine care. You know, that expands access and reduces, you know, the cost of that visit. I understand the political dynamic at the state level. I understand that, you know, some of the medical specialty societies or the nurses or whomever, there's a great deal of push-pull there. The Wall Street Journal article talked about California, and, you know, the nurses, you know, are battling different constituency groups there. But I think it is a fight worth having, and I think it's worth talking about. The other one that goes with that, of course, the certificate of need laws, which is somewhat similar in terms of a restriction imposed on the state level to try to open things up to expand access and reduce costs.
We're out of time, so last question.
So your last one.
I just wanted to, I know you're about to wrap up, but you know, as states consider expanding through this mechanism or through a voucher or any way, I just wanted to kind of wrap up with a quick remark. We had a speaker come in, actually a public policy presentation here in Georgia a couple months ago. It was actually an old advisor to Margaret Thatcher. And when Thatcher ran in 1979 as this great reformer that was going to denationalize industries, one of her campaign mottos was, sort of by necessity, she said that the national health care system is safe with us. That even Thatcher was not willing to attack the national health care system. Because in the words of this advisor, she said that long since had the National Healthcare Service in Britain replaced the Church of England in the hearts and the souls of the British people. And that is a reminder to me as we consider this, that, you know, like Jonah Goldberg said, you know, this is, Obamacare is the Machiavellian masterstroke of the middle class. That this is really a fight not about the delivery of health care or practicality of how it's delivered, but it's really a matter of making the middle class functionally dependent on the federal government for the basic sustenance. And it is a changing of the heart of the American people. And when you have advisors who've seen a nation that was once much like ours, that really within our last century made this flip, it's a much bigger question than some of the practicalities that I believe we have an obligation to resist at every corner, because the hearts and souls of America and what it means to be a free people is really in play.